Good morning, and welcome to today's session on the California Data Exchange Framework, a primer for area agencies on aging. My name is Robbie Franceschini, and I'm the Director of Policy of Blue Path Health. We're one of the consulting partners working on the Multi-Association Educational Initiative, a grant that's been administered by the Center for Data Insights and Innovation to work with stakeholders to educate them and their members about the data exchange framework that California has launched just last year. Before I get started, I just really want to thank our partners at C4A, who are one of the partners that are in the Multi-Association Initiative. In particular, Michael Costa, the Executive Director, as well as Katie Weber from Pop Health Solutions, the Data Exchange Framework liaison to AAAs as part of this work, who helped shape this presentation this morning. As part of this presentation, we'll give some background on what the data exchange framework is, what its principles are and how it's been grounded, as well as a little bit more detail on what's in the data sharing agreement associated with it and what work is to come. To wrap up, we'll tie this work into several CalAIM initiatives underway to illustrate how data sharing and the data exchange framework can help support these efforts and AAAs in their quest to be a part of these really transformative health reforms in California. So to begin, what is the California Data Exchange Framework? This is an initiative launched by the California Health and Human Services Agency as part of AB 133, which was a bill passed in 2021. And that called on the California Health and Human Services Agency to create the first ever statewide data sharing agreement in order to accelerate and expand the sharing of health information amongst healthcare entities, government agencies, and social services programs as well. I think as you'll see in this presentation, the definition has expanded beyond just health information to also include social services information, which I think is a key place where AAAs and other partners such as CBOs and social services agencies will really play a key role in this work going forward. Undergirding the data exchange framework is a set of key principles that the California Health and Human Services Agency developed in consultation with stakeholders over the course of 2021 and 2022. Just to highlight a couple, I think number one, advanced health equity is a really key principle that the agency as well as stakeholders defined in that process. Advancing health equity is key to Governor Newsom's Healthy California for All initiative, and really, I think, has been a driver of a lot of the conversations that in order to really meet our state's health equity goals, and whether that's through CalAIM, whether it's through public health initiatives, that we won't be successful unless we have the data sharing infrastructure and the data sharing capacity itself to be able to care for the needs of Californians, whether they are health or social needs. A couple others in here that I'll point out too that I think you'll see will come up in the policies and procedures that have been developed in the data sharing agreement. Promoting individual data access has been one of the key parts of this initiative, making sure that individuals, really can access their information, as well as reinforcing individual data privacy and security. A lot of conversations gone into what does HIPAA do and not do, and where are there gaps when it comes to state policy and law, and how do we ensure that we are adequately and securely exchanging health and social services information. Additionally, the state developed a vision for this work in California. And really the vision is that every Californian and all of their providers, so whether they're health or human services providers, have timely and secure access to the usable electronic information that's needed to address their health and social needs. So what is the data sharing agreement? And if you're thinking about this, from a super practical perspective, what is it that you'll be signing? So in July of last year, the California Health and Human Services Agency and their partners within the agency the Center for Data Insights and Innovation published the finalized data sharing agreement and initial policies and procedures. There's two key pieces to this work. One is the data sharing agreement itself, which is the core legal agreement that outlines how a broad set of, in particular, healthcare organizations who are mandated under AB 133 to share data, as well as other organizations that choose to sign on, what the requirements are from them in terms of their obligations when they sign. Additionally, there's a set of policies and procedures. These are all of the details that really specify how data is shared, in what ways it's shared, what is shared, what are the rules of the road. This is where privacy and security come up, things like individual access to data, as well as other topics like information blocking. These were all developed in consultation with stakeholders and continue to be so. Definitely encourage folks and have some information at the end of this session about how you can stay tuned into this work, whether through the multi-association initiative or of your own accord in terms of plugging into the stakeholder meetings that the state has been hosting as well. And I'll just mention too that the state, the Center for Data Insights and Innovation, has really put an emphasis on making sure to align with and leverage different federal and national standard setting organizations and laws and policies. So whether that's HIPAA, TEFCA, which some of you may be familiar with in the health IT world, as well as other initiatives like the Gravity Project and how we code for social needs in healthcare settings. In terms of the timeline for this work, as was mentioned, AB 133 was passed in July of 2021 and signed by Governor Newsom, which called on the agency to develop a data exchange framework with stakeholders, as well as an accompanying data sharing agreement and policies and procedures. Fast forward to July of last year, 2022, these two items were published, as well as a digital identity strategy that the work of which is still being worked out with stakeholders around how we adequately identify individuals and share information related to person matching. In January 31st of this year, there was a requirement by that date for certain healthcare organizations to sign the data sharing agreement. And we'll give a little glimpse of that in just a moment in terms of what those organizations are, which may be really helpful information for AAAs in understanding some of your key data sharing partners that likely have signed the DSA. In terms of what is coming up this year, a couple key things to keep an eye out for. One is the QHIO application that is forthcoming, as well as the program itself. So this program is going to develop these qualified entities, qualified health information organizations, that signatories to the data sharing agreement will be able to join, and who will be able to help those organizations both request and receive information on their behalf. There are several organizations that are likely to be selected. These organizations have to meet certain financial and security requirements under the draft application that's been developed, as well as be able to serve the data sharing needs of signatories, whether they're health or human or social services organizations. Additionally, in January 31st of next year, the organizations that sign this year, the DSA itself will take legal effect in January 31st of next year. And then in 2026, a little bit further off, is when there's a mandate for remaining entities to implement the data exchange framework and sign the data sharing agreement. So what organizations were required to sign the data sharing agreement by January 31st of this year? These include a few key stakeholder types. So one, general acute care hospitals, as defined under the Health and Safety Code in California, physician organizations and medical groups, skilled nursing facilities, Healthcare service plans and disability insurers. So healthcare service plans, that includes those that are regulated by the DMHC, the Department of Insurance. Clinical laboratories were also included, as well as acute psychiatric hospitals. I will note that there was an exception for small physician practices of 25 or fewer. They do not need to sign the data sharing agreement or share data until 2026 under the DSA. So if you're curious, how do I sign the DSA and how do I determine whether my organization may have already signed it? So late last year, the Center for Data Insights and Innovation launched the Data Sharing Agreement Signing Portal. This is available through the Cal HHS website. And on a nearly a weekly basis, the center has also been publishing a signatory list indicating to stakeholders who has signed. So if you're curious as to whether your organization, your county health and human services, or other agency has signed, you can check out that list on the Cal HHS website as well. And as part of this work with the Multi-Association Initiative, we are working with all of the partners to understand the extent to which their membership has signed the DSA. So stay tuned for more information on that. We're currently working with C4A as well as the 5 other associations to understand the extent to which their membership has signed the DSA and where gaps remain. Another key item to point out for AAAs are the grant and funding opportunities that are forthcoming as part of this data exchange framework. The first, which the Multi-Association Initiative is part of, is a set of educational initiative grants that CDII gave out early this year, really to help associations with educational initiatives so that stakeholders understand what the data exchange framework and data sharing agreement are and how to sign. Additionally, in coming later this year, will be 2 sets of other quite significant grants. One set are TA grants, and another are for Qualified Health Information Organization onboarding grants. These are both meant to help signatories get funds to be able to meet their data sharing requirements and really scale up their capacity. So the QHIO grants, these are meant to help with onboarding to one of those qualified entities that CDII will be qualifying this year. And the TA grants, these are meant for those organizations that may be choosing not to go with a QHIO, but otherwise need technical assistance to acquire, say, new technology from a vendor or upgrade their technology to be able to have the capacity to share data. So the Multi-Association Initiative, what is this and who's part of it? So in addition to C4A, 5 other associations, including the Association of Health Information Exchanges, the California Academy of Family Physicians, the California Association of Health Facilities, America's Physician Groups, and the California Quality Collaborative have all banded together as part of a single initiative to educate their membership on the data exchange framework and the data sharing agreement. So as part of this work, my firm Blue Path Health as well as Transform Health, we are serving as the consulting supports, providing backbone management and communications supports. And specific to C4A, Pop Health Solutions and Katie Weber are serving as the DxF liaison as part of this work. We have developed an information hub for stakeholders, and in particular the members that are part of these associations. We encourage you to check this out on our website on connectingforbetterhealth.com. And on this website, you'll find a couple things. You'll find educational materials. So we are linking to a lot of the key CDII documents related to the data exchange framework. We also have fact sheets and other content that we've developed, including recordings and events such as this one, so that folks can get educated on what the data exchange framework is. We also are collecting and publishing testimonials, so key stories and quotes from members and staff around what impact data sharing has and can have on their work. We're developing a speakers bureau so that if you are interested in bringing an expert of some sort to a meeting or an event, you can easily find speakers who you can pull from our group in order to come in, work with your staff or your membership to understand a little bit further what the data exchange framework is. And we're in the process of developing an FAQ, in addition to the one that the state has put out, specific to the questions that we are getting from all of the associations in their membership as well. So putting this work in context, why is the data exchange framework relevant to the work of AAAs and CBOs and other healthcare partners? And I think it really comes down to the CalAIM initiatives that are underway that really require data sharing to be successful. So to start with, enhanced care management and community supports, two of the really key initiatives in CalAIM really require the sharing of data in order to really integrate together health and social services organizations to meet the health and social needs of Medi-Cal beneficiaries. So within this work, we've previously held workshops, including with C4A, to understand what are the data sharing needs of social services agencies and other healthcare partners. And often it comes down to really simple needs. How do I submit claims for payment in a much more streamlined way? How do I receive alerts to know when someone's been discharged from the hospital? I think in these key ways, the data sharing agreement really stands to offer benefit to organizations in terms of standardizing how data is shared and requiring that signatories actually share data too. So it really provides those rules of the road. Population health management is another key area. So as many of you may know, the Department of Healthcare Services has laid out a population health management strategy. And as part of that work has procured a vendor to build out a population health service that will really be a data aggregator for the department in terms of collecting health and social needs related data on Medi-Cal beneficiaries. So key to that will be being able to get especially the clinical and the social needs data that the department will need to really be able to understand those insights and the needs of beneficiaries. And then additionally, duals integration and the long-term care carve-in, as that work is rolling out, really understanding how can we braid together, the variety of care providers that serve, in particular, those who are in the Medicare and Medi-Cal program in California, and thinking about not just, traditional healthcare organizations like hospitals and ambulatory providers, but also skilled nursing facilities, AAAs, PACE centers, and others who are really serving the whole person. So a couple key takeaway points to share with AAAs. At this time, as was mentioned, AAAs are not a required signatory to the data sharing agreement, but they and their parent organizations can sign now. We know that many counties in particular have signed the data sharing agreement. And in addition, the DxF deadline of January 2023, that pertains to mandatory signatories, as we mentioned. So really thinking about who are your key data sharing partners, have they signed the DSA? And what impact might that have potentially, not just on your assessment of whether you should sign the DSA, but also much more largely in terms of your own data sharing needs and doing an assessment of whether the DSA really can support that work. But regardless, AAAs, they can share data locally now. There's no need to wait for CHARM to roll out. The data sharing agreement is underway, and as was mentioned, CalAIM is underway too. And we know that some AAAs are currently exchanging data with health plans through CalAIM. Just to note, this work is all subject to state and federal data sharing requirements. I think the Center for Data Sharing, Center for Data Insights and Innovation has really been attuned to, not just healthcare laws, but also others that impact privacy and security requirements in particular, in making sure that those are accounted for in the data sharing agreement. So where to find more information? First, the Center for Data Insights and Innovation Data Exchange Framework website is a great resource. It has all of the archives of every meeting that the center has held related to the data exchange framework. There you can also find the text of the data sharing agreement, the policies and procedures, and some of the drafts that are in development. Additionally, Connecting for Better Health, which is an associated project to Blue Path Health, we've put out a data sharing agreement and policy and procedure fact sheet for stakeholders to really understand in a more condensed version what is in the data sharing agreement and the policies and procedures, and who do they apply to, and what is some of the detail there. And then additionally, the Multi-Association Data Exchange Information Hub, as I mentioned, which is a really curated resource for AAAs and C4A members, as well as other interested stakeholders that are part of the associations. So if you have any questions, please feel free to drop us a line. So we have developed a specific inbox for this multi-association initiative, DxF Education at connectingforbetterhealth.com. You can also feel free to reach out to myself directly if you would like, as well as Katie Weber, who is the DxF liaison for the AAAs in this project. So thank you for your time today. Please feel free to reach out with any questions you have, and we thank you for your partnership.